Hi, my name is Eileen Lochran, Director of the Office of Overdose Prevention in Population Behavioral Health. Thank you for taking the time to watch this brief informational video to learn about the different kinds of treatment available. The drug supply is unregulated and killing people at an alarming rate, while the most effective way to prevent an overdose is to avoid all substances. Services and treatments exist that can help reduce health risks and the risk of overdose. The Department of Public Health has made investments across numerous treatment strategies to save lives from overdose death. Today, you will hear about the continuum of services that are offered in our system of care. To enter treatment, call the 24/7 access line or drop in at our Behavioral Health Access Center.
The San Francisco Department of Public Health has partnered with SF-Gov-TV to make a short video to raise awareness about the services available on the treatment continuum. The Department of Public Health believes that everybody deserves health and well-being, no matter what their relationship is with substance use. We define treatment as anything that helps keep people safe and moves them towards their health goals. When we're thinking about changing behaviors or thinking about those health goals, one model that we often use is what's called the stages of change model. The stages of change are psychological phases that a person goes through when they're deciding to change a habit. Now, even though you might not have heard the phrase stages of change before, you've probably come across it in your daily life. Let's say, for instance, I go to the doctor and my doctor tells me I need to exercise more. I might start off by thinking, I'm too busy, I can't do that right now. This is what we call the pre-contemplation stage, before I even start thinking about wanting to change a habit. Once I'm in that phase for a while, I might start thinking, okay, I do want to exercise more, but I need support in figuring out how to do that. This is what we call contemplation, so thinking about changing a habit. After that, I might move into preparation or action. So I'm looking up exercise routines, I'm going to my first gym class, I'm taking steps to begin to actually change my habit. And finally, I might move into what we call the maintenance stage. So now I've built a habit and I'm consistently maintaining it, like I'm going for a walk every night after work. People move through the stages of change at their own pace. But with support and with counseling techniques like motivational interviewing, we can empower people to move from one stage to another. Our goal at DPH is to help identify a person's stage of change and then work with them to motivate them to move towards whatever health goals they have, while being non-judgmental and supportive. We recognize that people might need different kinds of services at different stages of change. So rather than limiting treatment access to people who are in a certain stage of change, the goal of having a spectrum of care is to give everybody services that they want and that they're able to use, no matter what stage of change they're in. DPH supports a continuum of treatment services because we recognize that people have different needs and goals, and what might work for one person might not work for another.
Overdose prevention programs provide health-related services and other resources to reduce the risk of overdose for people who may not be ready or able to stop using drugs. Because these programs are easy to access and provide a non-judgmental atmosphere, they can also play a vital role in getting clients to engage in other services, including naloxone and overdose prevention training, treatment, and ongoing health care. Syringe programs provide access to supplies like syringes, naloxone, and wound care. Studies show that they prevent the transmission of diseases like HIV and hepatitis. They also serve as a place for people to safely dispose of used syringes, reducing syringe litter in the community. Our syringe programs also provide other health services to people without appointments, including medication storage lockers, counseling, HIV and hepatitis C testing, and medical care services. Syringe access sites build relationships with people who use drugs, increasing the likelihood that they will engage in other health and social services. Low-threshold counseling aims to remove the barriers people who use drugs can experience accessing traditional counseling and therapy. Counselors aim to reach people who currently use drugs or may be considered hard to reach, and often provide counseling alongside outreach teams, mobile services, syringe access sites, drop-in centers, and shelters to meet people where they're at.
Sobering centers provide a safe space for intoxicated people to get off the streets to a safe place indoors. These programs are short-term and available to someone coming down from being high or intoxicated. Withdrawal management provides a safe space for people to rest and recover under the supervision of medical professionals. Many programs also support clients in finding ongoing care after leaving the withdrawal management program. These programs are short-term, usually less than 1 week, and are designed to provide immediate support to someone who is experiencing withdrawal. Residential programs provide a living environment with treatment services. Treatment in these programs lasts from a month to a year or more. Residential programs can be good for people who do not have stable living or employment situations and/or have limited to no family support. Outpatient treatment is provided at a program site, but usually the person lives elsewhere, usually at home. Outpatient treatment is offered in a variety of places: health clinics, community mental health clinics, counselors' offices, hospital clinics, local health department offices, or residential programs with outpatient clinics. Medication for addiction treatment, also known as MAT, is a prescription medication that can be used to treat unhealthy substance use and reduce the risk of overdose deaths. MAT is not about replacing one drug for another. It's about improving people's quality of life by reducing the symptoms of unhealthy substance use and making it easier to do things like maintain relationships, access medical and social services, or hold down a job. Addiction is a medical condition, and MAT involves medications that people can take to control their medical condition. The same way that someone who has diabetes may take insulin daily in order to stay healthy and avoid complications of illnesses. Recovery living facilities are housing sites for people aiming to continue to avoid substance use. These sites provide safe and healthy environments that supports residents in their recovery.
All these services have the same goal: to help people achieve their health goals with substance use and lead happier, healthier lives. DPH continues to support and oversee the expansion of the full range of services available to people who use drugs and who are at risk of an overdose.
Thank you for watching. Again, services and treatment are effective and available in San Francisco. If you or someone you know is interested in treatment, please call the 24/7 Access line or visit our Access Center listed on the screen.